In the last 10 years, our success rates have been above 40% for take-home baby rate in most reputable in vitro fertilization centers. And so there's a high chance, actually, that this will work. That having been said, there's not a certain chance that this will work for everybody, and I think that's where the problems come. In vitro fertilization, as the name implies, is to remove an egg from an ovary and to fertilize it in a laboratory using either direct insemination, which we call intracytoplasmic sperm injection, or a technique where we actually approximate the eggs and sperm in a petri dish, which actually simulates natural fertilization, and then watch for the development of an embryo. We wait anywhere from 2 to 5 days before transferring the embryo back into the uterus, and then we wait about 5 to 7 days to know whether it implants. If it implants, there will be a positive pregnancy test, and about 80% of the time after that there's a live birth. Age is clearly the single biggest limitation for success in IVF. And while there is some kind of age-related factors for male fertility, they're not as dramatic as they are for women. So we start to see a decline in egg quality in women starting around 35, even maybe sometimes before. And certainly by age 40, it's easy to see that there's a reduction in both egg number and egg quality. And by 45, we really don't offer in vitro fertilization. Most programs actually stop offering at age 42. For Melissa, it seems like she was concerned about the financial outlay and what the impact of that would be. Insurance does not always cover the procedure, or it may partially cover the procedure. And the chances of having a normal baby with IVF are about the same as through natural conception. But in vitro fertilization itself doesn't seem to introduce very many hazards. There's a couple of conditions that we call imprinting disorders, but their risk is not very high. And all in all, I would have to say to you that I think this is as safe as conceiving naturally.